We treat a condition called lymphedema, which is normally occurs after surgery. I've got a picture of what lymphedema looks like. Oops. This lady's got lymphedema, minus the spots. She doesn't normally have spots, but you can see that one leg is considerably bigger than the other. It happens when there's damage to the lymphatic vessels and one arm swells, or one leg swells. As I said, we're a very small company. In order for us to be successful, we had to take our product globally, and in order for that to happen, we had to align with the university or with a university to gain the credibility that we needed to actually take that product internationally. What we did was we engaged with the university to develop a clinical trial. I've actually done other clinical trials with various universities. I've done 2 with Adelaide University, and we're also working with the University of Arizona. The University of Arizona connection came through our connection with Flinders University. So by working with the university sector, we've actually been able to engage across international universities as well as the local ones. Our company is really small. We've got 2 employees. So you don't have to be big. You can actually engage with the university at a very, very low level. And I think that's been one of the advantages of it for us. So as we've already heard, the advantages of working with the university with access to internationally recognised researchers, that's a point that I'd like to make from an industry perspective. What I was surprised by are the number of researchers in this state who are actually internationally recognised. And I didn't find that out until I went overseas and started mentioning names, and everybody knew who I was talking about. So I think we underestimate some of the skills that we've got hidden in some of those corridors and in room 34 down corridor 53, who actually have internationally recognised expertise that they don't stand up and shout, but it is there and it is in the universities. Technical equipment expertise, as we've talked about, credibility, and the all-important scientific thinking that you never have time to do when you're actually working in your business. This is a piece of equipment we had access to. I show the picture of it because it's a $30,000 piece of equipment that I could never purchase, that we were able to use in our clinical trial. And the same with this piece of equipment that the woman's standing on. Same thing, $35,000 worth of equipment. The university had it. We were able to utilise it in our research. We would never have access to it without working at the university. As a result of the clinical trial we did with Flinders, they published a double-blind crossover trial that was published in Cancer, which is a highly rated journal. That led to us getting American Food and Drug Administration approval. So we had a lot of problems with the FDA. It was an ongoing 4-year process, and the person that sat next to me at the critical meeting was someone from Flinders University. And I'm sure that we wouldn't have finally got that approval if I didn't have the support of the people from Flinders. I have to say that the researcher that came with me, he's worn his suit 4 times. Once when he got married, and 3 when he's been to meetings with me. Both of those journals are international journal, and it was good for the researcher because he'd actually never had a publication in something as highly rated as Cancer. So it was actually good for both of us. The advantages of working with industry for, well, I think the university gets, and you've had these, I'm not going to go through those again. I did put up tips. What's important? How do you work with researchers? We've heard these too. Recognise the skills. Money is not always the incentive. Food. You might say, well, have I got food? I found that the best way to get the researchers to listen to me was to feed them. And curry worked really well. Karen suggested sticky buns. If you want to come and engage with her group, then a bag full of sticky buns will help. It's not so much about the food. I think it's about the collaboration that goes around that. And what was important for me was to actually get the researchers out of the research institution so they had some think space and time. No one's mentioned the ethics. What I found very different between industry and university is the ethical stuff. And sometimes industry has trouble understanding that researchers want to maintain their ethical boundaries, particularly in medical devices. So that's something that industry needs to be aware of. You've got to be interested in the science and understand that you can't ask the university to do something relatively quickly. So these are more things. Probably the and this came up just in discussion with Karen, and probably the last one is the most important one. If you're an industry person, never say, my taxes pay your salary. It's the clear way to get a researcher offside. Work out the IP, if we said. Another one that's important is if you agree to pay, then pay. You know, don't promise something to a research group and then not come up with it, particularly if it revolves around money. And then I thought about it, what about the other way around? And it was interesting the number of areas that are actually the same. You do have to recognise that each group has their own set of skills and you've got to value them. And researchers have to understand the industry timelines. So that's much the same. And that same thing, if you agree to do something and you're a researcher, you need to do it. Don't sort of make all sorts of claims and then not deliver. That's all I'm going to say. Thank you very much.
Thanks, Anne. Anne?
I've got to say something else. Karen's just pointed out that what I was supposed to say is that I enjoyed working with the university so much that I actually now work part-time with MDPP. I forgot to say that.
Thanks, Anne. Anne actually met with me earlier in the week and she didn't bring any food at all, so I'm not sure what that tells me or whether I should put that on the agenda for our next meeting.